Health promotion for cardiovascular disease in remote Aboriginal areas. Presented by Natalie Deep, Sarita Pandi, Jackia Sulatana Sharna, and Perry Ileto. Aims and objectives: to recognize the social determinants of health affecting Aboriginal and Torres Strait Islanders living in remote areas of Australia, to provide an overview of the prevalence of cardiovascular diseases in the Aboriginal Australian community, to discuss how the culture and health of Aboriginal Australians are linked and how it results to their current health status, to outline the nursing responsibilities needed to provide a culturally safe and competent care for the Aboriginal and Torres Strait Islanders, to discuss some of the health promotion programs implemented in the remote areas of Australia designed to improve the cardiovascular health of the Aboriginal Australians. The barriers to successful implementation of the health programs and strategies to overcome those barriers will also be tackled. Aims.
Before we start our presentation, we would like to take the opportunity to acknowledge that we are standing on the traditional land of the Barmatagal people of Darug Nation. We offer respect to all their elders, past and present, and the traditional custodians of the land. The definition of health vary within the culture and the community. Therefore, different culture has different definition of health. For instance, some believe absence of illness is being healthy or being within the community is healthy. For that reason, it is important to comprehend the meaning of health of Aboriginal community prior to initiate health promotion. The definition of Aboriginal health refers to not just the physical well-being of an individual, but refers to the social, emotional, cultural well-being of the whole community, in which individual is able to achieve their full potential as a human being, thereby bringing about the total well-being of their community. It is a whole life view and includes the cyclical concept of life, death, life. As from the definition of Aboriginal health, it can be perceived that their well-being is strongly related to their community and culture and their perception of collective society. However, in recent days, Aboriginal community is experiencing a lot of health issue, and cardiovascular disease is one of the major cause of mortality. Therefore, it is important to know their history of previous and present culture that is related to their health outcome. In this slide, I will discuss the link between Aboriginal culture and health. The health of Aboriginal community is strongly correlated with their culture, history, and spirituality. Aboriginal community was so connected to their land and sea. They had a strong social and spiritual connection with each other. Their spirituality, such as a lot of ceremonies and songs and stories, maintain their social and psychological well-being. The Aboriginal community mainly involved in farming and consumed a lot of healthy foods such as vegetables, fruits, seafood, and fish. Therefore, they were very healthy and strong before colonization, and they had less disease in the community. Aboriginal community was so hard worker there, and they were referred as hunter and gatherer and transient to gather their food supply. According to the Royal Australian College of General Practitioner, the culture was so strong with tradition, spirit, and thus they maintained their emotional and physical well-being. However, after colonization, the traditional land had been taken away from Aboriginal community and they've been forced to live in the mission. In the mission, their human right had been abused and forced to consume flour, sugar, and tea that contradict their traditional food and diet. Aboriginal community undergone a changes from healthy fiber-rich diet to high carbohydrate and sugar that led them to have many health issues. In the mission, they were living in inactive life, which was completely opposite of their normal active lifestyle. Furthermore, their children had been taken away and isolated, and the community was forced to lead a restrictive lifestyle. They've been introduced to many diseases that they were not immunized, and consequently, many Aboriginal people had died. This history of cultural trauma has big impact on their present situation and chiefly on their health status. For instance, greater rate of cardiovascular disease has developed and therefore the life expectancy is less than non-indigenous people. Many of the remote Aboriginal communities are still isolated. They do not have sufficient health literacy and healthy food to consume. In the next slide, I will discuss further why it is important to do health promotion in the remote or Aboriginal community. Importance of health promotion in the remote area. Before I talk about why health promotion is needed in the remote area, I would like to provide the definition of health promotion. According to WHO, health promotion is the process of enabling people to increase control and to improve their health, and to assist focus on the social determinant of health and environmental intervention. Remote areas in the Australia has significant amount of inequality in their determinants of health. Therefore, it is essential to focus on the health status of Aboriginal communities, especially in the remote area. As majority percent of Aboriginal people living in the remote area are experiencing geographical isolation, health inequality, and resource inequity. This has great impact on their burden of disease, such as cardiovascular disease. The percentage of cardiovascular disease is higher in the remote Aboriginal community compared to the community living in rural or urban area. It is important to research why the number of cardiovascular disease is high in the remote Aboriginal community. The remote Aboriginal community has lack of access to the affordable healthy food and that can lead to many preventable disease such as cardiovascular disease. The remote Aboriginal community has higher rate of alcohol and tobacco consumption compared to the non-indigenous people. Remote Aboriginal community has limited access to the doctors. Many Aboriginal people does not want to seek medical advice from white healthcare professionals due to lack of trust and fear of racism. The burden of disease is therefore not only related to their physical well-being, it is also related with their many factors. Therefore, it is essential to undertake health promotion because health promotion addresses the economic, social, cultural, and environmental factors of health to enable people to control the factors that influence the health.
Good morning or good afternoon, everyone. My name is Natalie, and you have come across to my portion of the presentation. This is where I will be speaking about cardiovascular disease in the remote Aboriginal community and focusing on some social determinants that are factors that may have influenced the rates of cardiovascular disease or trends found in the remote Aboriginal community. I'd like to introduce the topic of cardiovascular disease in the Aboriginal and Torres Strait Islander community and a briefing upon this subject. Cardiovascular disease, or CVD, is a major cause of premature death experienced by Aboriginal and Torres Strait Islander Australians. It contains a high prevalence so common within the Aboriginal and Torres Strait Islander people that cardiovascular disease strikes 10 to 20 years younger than non-Indigenous Australians. This disease is responsible for the 12% of burden of disease amongst Aboriginal communities. Here, the illustrated pie graph depicts where 1 in 8 Aboriginal and Torres Strait Islander people reported in 2012 and 2013 Australian and Aboriginal and Torres Strait Islander Health Survey, reported that they had some form of cardiovascular disease. 1 in 20 reported having high blood pressure, and 1 in 25 reporting having some form of heart, stroke, or vascular disease. Aboriginal and Torres Strait Islander people living in remote areas were more likely to report having heart disease than those living in non-remote areas. Cardiovascular disease not only causes physical limitations, but social limitations and unstable health, meaning cardiovascular disease patients may become mentally ill, such as depression. Following this portion of the presentation, I will further discuss determinants that may have affected the result of cardiovascular disease trends in Aboriginal and Torres Strait Islander people.
The first social determinant I would like to discuss is education, as a factor that can contribute to cardiovascular disease trends and onset amongst Aboriginal and Torres Strait Islander people. Education is a vital and valued determinant that is necessary to facilitate a healthy lifestyle. Although, for Aboriginal and Torres Strait Islander people living in remote communities, the significance is not merely recognised. Indigenous school rates are higher in metropolitan areas and lower in remote areas. This is due to the reduced access to educational services. According to Close the Gap in 2017, the attendance rates for Indigenous Aboriginal students range from 86.8% in inner regional areas to 64.4% in remote areas. This can severely jeopardize succeeding a healthy way of living by enhancing poorer health outcomes. A minor amount of schools and decreased attendance leads to low health literacy and numeracy, where more than 80% of Indigenous Aboriginal students achieve minimum nation standards. The Remote School Attendance Strategy is a recently formed initiative that aims to enhance attendance in remote Aboriginal and Torres Strait Islander communities. This initiative acts in involving the community to develop plans of transport for students to arrive to and from school, whilst offering support strategies and incentives to improve attendance. Education is a point of contact where knowledge of preventative and interventional measures is gained and can be utilised for a lifestyle. Without this foundation, Aboriginal and Torres Strait Islander people may not be engaged or aware of cardiovascular disease, and knowing little to no information about how it develops, what occurs when diagnosed, treatment, risk factors, or preventable measures. One highlighted modifiable risk factor that causes cardiovascular disease is smoking, which falls under the category of substance abuse. The Rural Health Organisation establishes that people with lower levels of completed education are more likely to smoke, due to being unaware of the impact and complications of smoking. Smoking is recognised as the largest preventable cause of death and disease for all of Australia, and is strongly associated with an increased risk of heart disease. Education also interlaces with the socio-economic determinant, as a high proportion of Indigenous Aboriginal students who fail literacy and numeracy cannot progress to jobs and careers, hence allowing fewer employment opportunities, limiting opportunities to fulfill a high wage-paying career. Drawing your attention to the pie graph I've illustrated displays that the unemployment rate for Aboriginal and Torres Strait Islander people across major cities is 13%, 19% in regional areas, and 15% in remote areas. This highlights a fairly large portion of unemployment in remote areas. The Aboriginal and Torres Strait Islander individuals are generally more prone to actively not look for work opportunities and hence being classified as unemployed. The lack of unemployment amongst the Indigenous Aboriginal people is associated with their health well-being, where it illustrates the impact of low income. People with a lower socio-economic status bear a significantly higher burden of disease. Low income creates disadvantages, such as incapability to create funds for goods, including fresh produce, which enables a healthy diet. Inadequate nutritious foods can increase the risk of cardiovascular disease, where a bad diet contains high amounts of fats, salts, sugars, and cholesterol. In addition, low income can create openings for substance abuse, involving alcohol and drug intake. These are also modifiable risk factors that cause cardiovascular disease to develop. Transport is also significant, in particular to the Aboriginal and Torres Strait Islander individuals who live in the remote area. Income can provide for transportation to and from areas that are necessary for a healthy lifestyle.
Health promotion and its challenges. Health promotion, according to World Health Organization, is a process wherein people are enabled to take control over the determinants of their health in order to improve their health status. Health promotion, which include public health programs that aim to reduce risks and promote preventive measures, are being implemented to support communities and families living in the remote areas of Australia. Listed here are some of the barriers that hinder the success of health promotion programs developed for the Aboriginal Australians. Some health promotion programs are not tailored to suit the needs of an Indigenous community, where a particular health promotion program is implemented on a national scale. Services or resources available to a certain remote Indigenous community is way poorer than other communities. Data collection to assess the program effectiveness is insufficient due to lack of support from the respondents, leading to an insufficient systemic evaluation process. Healthcare workers find it very challenging when the patients or participants are not forthcoming. The shortage of Aboriginal health workers in the community is because Indigenous health workers are excluded from decision making and have limited support from carrying out their work. Follow-up care is neglected due to staff lacking awareness or referring other services. Strategies developed to overcome barriers. Including Aboriginal healthcare workers in the decision-making process ensures the programs are acceptable from an Aboriginal's point of view, and would therefore increase the success of the program. Adequate support is also needed in order to implement such programs. Employing more Aboriginal healthcare workers would improve communications with participants of the program. It would promote a culturally safe program for Aboriginal Australians, thereby encouraging more participation. Educating the staff on appropriate services so that they can in turn educate participants would greatly enable follow-up care. Participants are more likely to improve their health status and be proactive in taking care of themselves when there are appropriate infrastructures and funding available. Cardiovascular health promotion initiatives in the remote areas of Australia. These are some of the health initiatives to promote cardiovascular health in remote areas of Australia. The Healthy Heart and Lungs program in the Northern Territory is a program designed to improve communication between English-speaking doctors and non-English-speaking Indigenous patients. It was developed because miscommunication between medical staff and non-English-speaking Indigenous patients is a serious and well-documented issue in the Northern Territory. With this program, Yeonju consultants participate in bridging the gap between health professionals and indigenous patients by using multimedia tools in order to enhance the shared experience of the health professionals and the indigenous Australians. The Health Club is a program developed in order to support indigenous families that have been affected by acute rheumatic fever and rheumatic heart disease in Wyndham, Western Australia. The Heart Health radio programs in West Kimberley are initiated in order to promote in-depth education on cardiovascular health and diseases over the radio for Aboriginal and Torres Strait Islanders in the West Kimberley region of Western Australia. The program was designed to discuss how the heart, lungs, and blood vessels function. It also dwells on the important topics regarding cardiovascular diseases and its risk factors such as smoking, high blood pressure monitoring, and signs and symptoms of a heart attack.
Today in this slide, I'm going to talk about the cultural competent and safe nursing and midwifery practice in the Aboriginal. Cultural competent is defined as the capacity to understand other cultures, values and principles and follow their structures, policy, procedures and communicate effectively among the across cultural people. The Aboriginal and Torres Strait Islander people have different culture, language and custom, however they are regularly disadvantaged with health services benefits. Cardiovascular disease has been the first leading causing death in Aboriginal societies. Nurses who deliver care should understand the patient health, beliefs, and values to promote health among multicultural populations. Nurses should provide quality care to all patients, regardless of age, sex, ethnic, geographical, and multicultural patient. Respect towards Aboriginal and Torres Strait Islander. Respect for Aboriginal culture. Nurses should provide respect towards Aboriginal and Torres Strait Islander diversity of language, lifestyle, and custom. The richness of Aboriginal people culture should be acknowledged and respected. Respect for communities. Nurses should respect the large family, extended structures, and family, as well as whole communities of Aboriginal and Torres Strait Islander while delivering care. Consultation, communication, and consent. Nurses should consult of care, communicate effectively, and taking consent before doing any procedure with the Aboriginal and Torres Strait Islander patient. Involvement and engagement. Nurses respect towards Aboriginal and Torres Strait Islander. Respect for Aboriginal culture. Nurses should provide respect towards Aboriginal and Torres Strait cultural communication using verbal and non-verbal skills. Cultural protocols effective, culturally competent care to the clients in society that supports the client's cultural value and ethics and various health that is related to that society. The effective communication will result in respect, dignity, as well as preservation of human rights. If the client's verbal communication and cultural values different, better to provide interpreter with the respect of cultures, values, settings, and gender. Protocols for the removing of name of dead people. Communication with the clients varies from different culture and country. It is necessary to interact with the local community for the right procedures for removing name, time, and period of evidence of pictures and name of dead person. To deal with the community, it is hard when person passed away. Death and sorry business. This impacts on whole communities. Culturally, it is hard to mention their name. The better way to contact with local Aboriginal health services or land council to contact with family member rather than going to family member when they are grieving. Smoking ceremony. This ceremony conducted by Aboriginal people who have special knowledge on culture. The purpose of the ceremony is to cleanse the place and the person where it takes place. This is only performed on special event.
Conclusion. Distinctiveness is imperative when considering the delivery of healthcare services to the remote Australian Indigenous population. Factors such as additional costs, transportation issues, sparse infrastructure and services, and the lack of healthcare staff are the major issues that hinder to a successful delivery of primary healthcare in remote areas. Furthermore, there are also issues in communication, cultural difference, and patient compliance that need to be addressed. Provision of culturally competent nursing care in remote areas is paramount, and certain consideration and understanding should be made as the communities residing in the remote areas are more culturally attached.